You may have seen this sign up on the wall in your care home and wondered what it was about or what relevance it has to you. Every year, thousands of care staff and residents become ill or are injured because of unsafe working practices or an unsafe environment. This video sets out to make you more aware of the many potential hazards in your care home and also explains your responsibilities for health and safety in your care home. Every member of staff has a legal obligation for health and safety in the care home and may be found legally responsible for accidents or dangerous incidents that may occur. This video was filmed in a care home for older people, and some elements of the video focus on specific hazards for older people, although the content of the video is applicable to all care environments. There are several laws governing health and safety in the workplace. The most relevant ones are Common Law, Health and Safety at Work Act, Management of Health and Safety at Work Regulations, COSHH, RIDDOR, Manual Handling Operations Regulations, Regulatory Reform Order. All employers have a duty to their employees to provide and maintain a working environment that is safe, without risks to health, and with adequate welfare facilities and arrangements for employees' welfare at work. Ensure safe handling, storage and transportation of articles and substances. Provide the necessary information, training and supervision to ensure the health and safety of all employees. Display or make available a certificate of employer's liability insurance. Display the poster Health and Safety Law, or distribute leaflets giving this information. Employees have a legal duty to take reasonable care of their own health and safety and that of others who may be affected by what they do or omit to do at work. Cooperate with their employer on health and safety matters. Do not interfere with or misuse anything provided in the interests of health, safety and welfare of themselves or others. Inform the employer of any shortcomings in the health and safety arrangements, even when no immediate danger exists. Employers also have a legal duty to take reasonable care of the health and safety of non-employees, such as residents, visitors, contractors. These duties are similar to those owed to employees. The Management of Health and Safety at Work regulations require employers to carry out risk assessments. The key points of the regulations require employers to carry out a risk assessment of hazards and risks, document the findings and implement relevant actions and procedures to protect health and safety. Employers with 5 or more employees are required to record in writing the significant findings of any risk assessment. This should be brought to the attention of all employees. Appoint competent persons to help meet the requirements. Ensure that temporary staff are informed of any health and safety information necessary to do their job. Consider the capabilities of each individual to carry out their job safely. The aim of the legislation is to make sure that the employer takes precautions to ensure the health and safety of employees and people entering or living in the home. This means that if the employer knows that the wiring on a piece of equipment is faulty but does not act, a breach of the law has occurred and the employer could face prosecution. The employer's health and safety policy details the employer's responsibilities and the staff's responsibilities. Make sure you are aware of its contents and of your particular responsibilities. The policy will give details of precautions to be taken to prevent accidents. For example, cleaning staff must not leave vacuum cleaner cables trailing across corridors unattended. The policy may also give details on the safekeeping of items, such as cleaning materials and medicines. It will also instruct employees about action they should take if they become aware of a hazard or a breach of the health and safety policy. Employers have a duty to provide protective equipment to employees, such as disposable gloves and overalls for domestics required to clean toilets, and moving and handling equipment such as a hoist for staff required to move residents. Documentation is very important. The attitude of the law courts tends to be, if it hasn't been recorded, it hasn't been done. Examples of records that should be kept include all plant and equipment servicing and maintenance, staff training, accidents and dangerous incidents, fire safety records, drug and medicines records, and the health and safety risk assessments, including COSHH and manual handling assessments.